Ladies and gentlemen, welcome to today's webinar on Beyond Skin Deep, the need to bridge the gap in psoriasis management, brought to you by Eli Lilly in association with ET Health World. Psoriasis is a chronic autoimmune disorder of the skin in which prolonged inflammation leads to dry, thick, raised red patches on the skin that continuously shed silvery scales. Psoriasis affects 2 to 3% of the world's population, which is roughly 125 million people. In India, approximately 1 to 3 out of 100 people are affected by psoriasis. Studies show that the impact of psoriasis has on a patient's quality of life is comparable to that of serious diseases such as cancer and heart failure. To understand more about this common skin disorder, I, Rashmi Mabian Kaur, Principal Correspondent at ethealthworld.com, would now like to welcome the esteemed speakers who have joined us today to provide a comprehensive overview on psoriatic diseases, its current best practices, and advancements in its treatment. To take forward this crucial discussion, please join me in welcoming our eminent panelists. Dr. Abhir Saraswat, Department of Dermatology, Venereology and Leprosy at Midland Healthcare, Lucknow. Dr. Imran Majid, Director at Cutis Institute of Dermatology, Srinagar. Dr. Soma Sarkar, Dermatologist and Skin Specialist at Dr. Soma Aesthetic Clinic, Mumbai. And Dr. Swapna Priya, Skin Specialist at Care Hospitals, Hyderabad. A very warm welcome to all panelists. And now, without any further ado, let's begin the panel discussion on the need to bridge the gap in psoriasis management. My first question is for Dr. Abir. What defines psoriasis and what are the major contributory factors to its potential risks?
So, as you said in your introduction, psoriasis is predominantly a skin disease, but the current understanding and the one that we are trying to make more understood by virtue of this program is that it is actually a systemic disease. It manifests on the skin and it manifests in the joints as joint pains, swellings, etc., backaches. So the main manifestations are on the skin and the joints. But for the past couple of decades, we have understood that it affects almost every system in the body, including the heart, the lungs, the kidneys, your ability, associations with diabetes, etc. What it looks like is what you've described: dry, scaly patches on the skin, on the scalp, on any part of the skin, in fact. And when it affects the joints, it can cause painful swelling of the joints. It can cause backaches, pain in the fingers, knees, elbows, any joint, in fact. And it is quite common, as you said. The causes are manifold. Uh, Unfortunately, it's not a simple disease. It is not caused by one single factor. The most important thing that decides whether you will get psoriasis or not is whether you are genetically predisposed to it. So if somebody in your family has it, your siblings have it, have you inherited a set of genes that predispose you to develop psoriasis? That's the most important thing. Once you have that background, then several things can trigger it off. And these things are to some extent not very clearly understood. What we know is that certain types of infections, bacterial infections, so for example, a sore throat or a viral infection of any kind, a fever, or even psychological events that affect the immunity, that is like a very stressful episode, a death in the family, a bereavement, anything like that can give the final push so that the genetic thing shows itself. And then you start getting skin lesions or you start getting your joint pains or whatever symptoms. So it's a combination of genetic predisposition and then a dysfunctioning of the immune system, which causes your immune cells in your blood to attack your skin and joints to cause these kinds of skin rashes and joint pains. And the triggers are manifold. The triggers are manifold. I think in subsequent questions, we will discuss some of those triggers further.
Okay, so going on to Dr. Imran, what specific types of psoriasis necessitate treatment and which areas pose greater or lesser challenge in terms of treatment?
Yeah, see, uh, I think every type of psoriasis has to be treated. That is the first thing that we need to remember.
Hmm.
But yes, there are some types where the treatment is really needed, really essential. And there are some types where it's an emergency to treat psoriasis. There are different types of psoriasis that we need to know about. There is the commonest type of psoriasis, which is known as chronic plaque type of psoriasis, which is the commonest type that we see. Then there is another type of psoriasis which we see that affects the flexures, the body folds, that we call as flexural psoriasis. Then there is a subtype which affects the joints, as Dr. Abir was just saying, and we call that as psoriatic arthritis. And then there is a type which involves almost the whole body at times, and that is known as erythrodermic psoriasis. So you have patients in home, you have more than 80% body surface area involved. Now, if you have a patient who has extensive body involvement of more than 80%, it's an emergency to treat. So you have to treat this patient, and you have to treat it not as an emergency that time. Second subset would be a patient who has psoriatic arthritis. Now, see, skin, if psoriasis involves skin, it's not going to lead to any long-term or irreversible complications on the skin. But if psoriasis involves the joints, it can lead to irreversible complications. So you can have joint destruction if you don't treat psoriatic arthritis at the right time. So a patient having arthritis, a patient having extensive body involvement, and a patient who has a lot of psychological stress out of the disease. So not all patients respond equally to psoriasis. Some are really psychologically disturbed by it. So these three sets of patients would be those in whom the treatment would be essential. But then you have to treat all patients of psoriasis. Now, regarding certain sites which are more difficult to treat, let's say. So flexural psoriasis is one type in which these body folds are more difficult to treat because the common things that we use in psoriasis, like steroids, they can lead to skin atrophy, skin thinning at these sites. So these sites had to be treated a bit differently and are a more difficult site to treat than the other parts of the body. Similarly, the pediatric age group, again, psoriasis, I think, is becoming more common now in children than it used to be. And we see very severe psoriasis now in children as well. So again, this subset of population is a bit more difficult to treat than adults because the choice of treatment here is limited, more limited than in adults.
Okay. So, Dr. Soma, my next question is to you. Psoriasis often correlates with metabolic disorders, including potentially fatal cardiac issues. What significant consequences should individuals consider in managing this disease?
So, as rightly said by the rest of the two doctors here, that psoriasis is no more only a skin disorder. It has definitely got more systemic in nature. And one of the most important organs, that is the cardiac region, the heart region, is definitely one of the target tissue here. And you can see on these patients that they have, while investigations, you can have elevated blood sugar levels, you can have elevated lipid profile, you can have elevated CRP protein. So these are things which we look upon when we are treating our psoriasis patients, because the same inflammation can also happen in your blood vessels, because the whole process, the pathogenesis of psoriasis, is basically related to your immune system. So it is not only in your skin cells, but it can also induce the inflammation in your blood vessels as well, because of which you can create those plaques in those vessels, create blockages to your cardiac tissue, and the patient can obviously suffer a cardiac myopathy, which is again going to be dangerous to the patient's health. So it is very important when we are counseling to the patient or when we are talking about psoriasis, we have to explain them the consequences of the disease. Not only that about skin lesions, how aesthetic or how physically it can hamper their confidence, but somewhere at the hindsight, the systemic concurrence simultaneously also very, very important to be explained. That's how we look at the metabolic disorders. So one of them, the important one, as I said, is the cardiac involvement, apart from the joints.
Okay. And Dr. Swapna, how does diet and lifestyle intersect with the psoriasis, and what lifestyle choices can either benefit or, detriment a patient's condition?
When you come to speak about the triggers of the problem, stress is one of the major factor for aggravation of the problem. The amount of the stress is very clearly seen in aggravation of their psoriatic patches, their itching and the scaliness and the onset of the new patches. So it is very important not we just treat the patient, but also counsel them about the triggers, not only in terms of stress, but also sometimes the other medications what they take. Sometimes patient might be taking like antihypertensive medications or painkiller tablets for their arthritis problems. They also tend to worsen their skin psoriasis. So we need to replace them with the better drugs, or we need to counsel them the NSAIDs or not to be overused so that the problem is under control. So these sort of important triggers, and even coming to the other factors like already which has been discussed about the metabolic syndrome, where they need to definitely keep a control on their weight, because the increased BMI will lead to metabolic syndrome. This leads to increasing worsening of their psoriatic patches. And more so when these patients are prone for arthritis, again, it becomes difficult to manage their arthritis also. Considering all these factors, stress, their medications, and also their body weight also plays a major role. And coming to even alcohol, smoking also are very important. Usually the medications what we use for psoriasis, they tend to have some effect on the liver. Though they are safely monitored, but when patient is an alcoholic, they cause more damage to their liver. So this leads to our reduction in choices for the future availability of the medicines what we can use for the patient. So it is also important we control the alcohol and also smoking habit, which increases the severity of the psoriasis. So these are the lifestyle changes which definitely should be counseled, reinforced in every consultation of the patient. And coming to the diet, because this is one of the most common thing with patients when they come to us, they ask what dietary modifications can we do. To say truly, evidence has not been completely been available, but multiple studies are now popping up on different theories like the taxis theory, role of probiotics for psoriasis, and also leaky gut, that is dysbiosis in the gut, and also the role of Mediterranean diet of more of vegetarian food or like monounsaturated fatty acids, which have probably decreasing the role of inflammation and decreasing the severity of psoriasis. So plant proteins are not complete proteins, so they don't have all the amino acids or whatever they are available for the inflammation. So that is probably one school of thought, which they say that red meat and all those proteins, like we speak about whether butter or red meat, which have all the complete proteins and also have a lot of cholesterol, which increase the inflammation and also lead to worsening of the problem. And encouraging probably fish, which has monounsaturated fatty acids, will help to decrease the inflammation. And including a lot of vegetables, fruits, which have a lot of antioxidants, probably has some role. That is the reason the Mediterranean diet has become more popular in particularly groups of patients for psoriasis. So this is how, but not that it is the only way of treating the patient of psoriasis, but these different school of thoughts are leading to think about in terms of if diet also can help to improve the severity of psoriasis in these patients.
Dr. Imran, if you would like to add something to that.
So I think we have to understand psoriasis as a part of a full metabolic spectrum, right? That is very, very important. Uh, Metabolic syndrome is something that the human race is currently going through, and a significant percentage of population in the whole world is suffering from a condition which is known as metabolic syndrome, in which you have uh, increase in the body weight, increase in the waist circumference, and increased incidence of fatty liver. So psoriasis is intricately related with metabolic syndrome somehow. And patients of psoriasis who have associated metabolic syndrome are more difficult to treat than those who do not have a metabolic syndrome. So it's a vicious circle. Psoriasis increases the chances of metabolic syndrome. And then metabolic syndrome now causes a less response of psoriasis to the treatment options that you give to the patient, and increases the incidence, the severity of psoriasis. So this vicious circle has to be somehow stopped somewhere, and there comes the role of a healthy lifestyle. And a healthy lifestyle does not specifically mean diet only. That's what something that we have to understand. It is a combination of many things: diet, your physical activity, how much of physical activity that you do per day. That is also very, very important in tackling psoriasis. And as Dr. Swapna was just telling us, that alcoholism, smoking, all these things, they all come under the realm of lifestyle. And if you just say in a single sentence, psoriasis needs a very healthy lifestyle. Uh, that is going to help in not just one thing. It's going to help us in many ways in tackling psoriasis. It's going to help us in improving our response to treatment. It's going to help us in maybe preventing recurrent relapses in the patient. So a healthy lifestyle is very, very important in a patient with psoriasis. So as doctors, we need to first understand this and then communicate this thing very, very vividly and clearly with the patients that come to us for treatment.
Okay. My next question is for Dr. Abir. What is the likelihood of children developing psoriasis if their parents have the condition?
So like I said, there is a very significant genetic predisposition to psoriasis. And this predisposition in the general population is to the tune of around 2 to 4%. So out of 100 people, randomly, 2 or 3 will tend to have psoriasis. So if you do not have any parent who has psoriasis, then your likelihood of getting it is the same as the general population. So something close to around 2 or 3%. If you have one parent, either your mother or your father, who has psoriasis, then this goes up dramatically to around 25 to 30%. But understand that it is still, this conversely means that 70 to 65 to 70%, 75% chance of still not having psoriasis. If both your parents have psoriasis, then this goes up rather drastically to around 60%. Still a 40% chance of not getting psoriasis. And this is the point that people need to understand. Sometimes when we tell them that it is genetic, they think that, it is 100%. If your parents have it, you're going to have it. Your kids are going to have it. So this is a classic multifactorial disease. Genetic component is just one part of it, although it is the most important part. But it is only to this extent. So both parents, about 60% chance of children getting it. And again, this does not mean that if you have, just for an example, 10 kids, 6 of them will get psoriasis. Each child individually has a 60% chance of getting psoriasis. All 10 may not get it. All 10 may get it also. So this is a fine point that we need to convey to our parents. It doesn't mean that if you have like 4 children, 1 or 2 are definitely going to have it. Each child's individual risk is about that much. And with one parent, it is about 25%. Similarly, if you have a sibling who has psoriasis, so if you have a brother or a sister who has psoriasis, your risk again, compared to the background population risk of 2 to 3%, it goes up about 10-fold or 20-fold. So it becomes about 20% or 30% if you have an elder brother or a younger brother or sister who has psoriasis.
So this question is for Dr. Soma. To what extent are biologics essential in the treatment of psoriasis?
So this is something which is, come to us as biologicals as a really, really a game changer when we are treating our psoriasis patient. Because the first thing is that they are something which we can administer. Now, when we started using biologicals way back, there was a limitation to the usage because they could be only given under hospital, coverage, or you require an intensive care unit where you require constant monitoring. But thanks to the development, and we have got now biologicals, which can be given at your OPD setup as well, or the patient can also take in the house itself with a proper monitoring and sometimes some education and training. They can do it themselves. So life has become much more easier for these psoriatic patients because the ease of treatment has also come into place with biologicals. The best part of biologicals is that your systemic issues, as Dr. Sapna definitely mentioned here, when we are on certain amount of drugs, we have to keep monitoring their electrolytes. We have to keep monitoring certain parameters, your liver parameters, your kidney parameters, which can be a tedious exercise for our patients. Also time consuming, also economically, they are drained while doing so many investigations at a regular interval. With biologicals, yes, you do investigations, but that's only when you're starting the biologicals for the first time. You have some basic investigation, but rest of the time you are absolutely cleared, and you can continue the medication and the drug without having regular investigation in terms of monitoring your electrolytes or monitoring your other parameters as well. also for the fact that biologicals have given the patient almost complete clearance of the skin. Almost to 95% of the skin clearance has been seen. Complications has been prevented. Arthritic issues has been taken care of. Metabolic syndromes have been taken care of. In fact, some of the biologics have also helped you to reduce your sugar levels in the blood. So we have multiple biologicals in the market, and we have to design or tailor them according to our patient require. As we know that the pathophysiology is multifaceted. We have number of multiple T cell immunity cells involved into it. So we have to choose our biologicals according also to the presentation. Sometimes it is very difficult, to come to a place where we say that, okay, only this biological will go on for your life, and you do not have to switch over to something different. But what I have also realized is that in the due course, we are getting new biologicals every second year, and we are getting better and better. So it is becoming easier for our patients to come to a doctor, and there has been a place where you can actually tell your patient that you will be completely cleared of these lesions. Yes, obviously it's not a permanent solution, but it's for a very, very long time. The recurrences are less, the remissions are less, the side effects of these drugs are less. So, it is very safe to administer. It has become easy to administer. Patients are also, it's a life-changing parameter. Your patients who couldn't do the routine, like they couldn't go to gym, they couldn't swim because of the social embarrassment, they could not move their joints. Now, those patients after the biologics have been so good and easy that they can have a routine life to themselves. So these biologicals have been really a blessing in our industry. And I'm sure, and I'm assuming there are more and more which are going to come to us, and which is a very, very good thing as a treatment line. Yes, it requires a little bit of methodical approach to it, but trust me, it's one of the best drugs that we have got available with us right now, vis-a-vis the ones which we always had, the conventional. Now we also see a huge spectrum of psoriatic subtypes here. So not everybody falls into the category of biologicals, because if a patient has only one or two skin lesions, or if the patient does have only seasonal aggravation, and if it's only related to any particular part, you might not want to put the patient immediately on the biologicals. Then you might always want to start with your conventional drug, topical application. But if your psoriasis become very resistant, it is not responding to your conventional drugs, if you see that it is becoming a trouble for the patient, or the patient is suffering due to the lot of involvement of the joints, cannot work, the joints have become stiff, it's painful, they are swelling, day-to-day activity is getting hampered, their social life is getting hampered. In such cases, I always feel the biological helps us a lot. Also, it cut down your treatment time, that the whole hassle of constantly applying the medication, the whole hassle of taking oral medication, keep them in, keep reminding themselves that, okay, this is the time, I can't miss my dose. If I miss my dose, what can go wrong? So all these things are bypassed here with the help of biologicals. And there are certain scenarios where your biologicals are must, where it is required, and it has definitely given good results to our patients.
Mhm. Okay, so the next question is for Dr. Imran. From your experience, and rather we are open to taking more responses in this question, because I'm sure this will help our audience a lot. From your experience, what treatment approaches are effective, and how can remission be maintained in patients? Dr. Imran.
Yeah. See, first of all, we need to understand that psoriasis, the severity of psoriasis varies from a very mild disease to a very debilitating disease. So the treatment approach for a patient with a mild disease is different from a patient who has a debilitating disease, right? So we are talking about biologics right now. So biologics are indicated in those patients who have a severe disease. But fortunately, the largest proportion of patients that we come across have a milder disease. So the treatment here would be different. So mild disease, you may just use some topical treatments. And then once the patient goes into remission, the lesions are cleared, you tend to withdraw the drugs. But it's very, very important that this withdrawal is to be done very gradually. So in fact, it's very important to tell the patient in the first visit only that, okay, Once you attain remission, your lesions are gone. It does not mean that the treatment is now over. It just means that we now can go to the next phase and start reducing the dose or the frequency of medication or change into milder medication.
Mm.
That is the thing that you has to be conveyed to the patient in the first visit only, that psoriasis has a high chance of recurrence and the treatment changes have to be done by the physician and should not be done by the patient himself. So if he attains remission, he comes back to the doctor and the doctor decides whether it's the right time to reduce the frequency or change to a milder drug or not. Second, I think the thing that helps in my patients is uh, advise them to use more of sunlight, or something that has helped me in my practice is I use home-based phototherapy. Like, let's take an example of, let's say we have a young girl who has psoriasis. She's a child, she has to go to the school. It's difficult to keep on applying those medications every day, every night. And then the risk of steroid induced side effects are there. So, what I do is I advise them to use a home based ultraviolet B lamp. Remember that one of the best forms of treatment for psoriasis is ultraviolet B light. And this light has the advantage of being the safest treatment in psoriasis. There are virtually no side effects of this treatment. So what I do is I advise them to get a UVB lamp, uh, and then we just counsel them how to use that UV lamp at their own homes. And once the girl or the boy he has a lesion, he just uses that lamp locally on the lesion, and then we tell them how to then withdraw the or decrease the frequency of the use of that lamp over time, and that helps them in maintaining a very long remission without any topical or oral drugs. So simple. If you're using topical or systemic medication, tell the patient that simple clearance of disease does not mean that the disease is over. The disease has gone to remission, it can come back. So the withdrawal of treatment has to be gradual and has to be done in consultation with the treating physician. That's very, very important.
Okay. Um, Dr. Abir, if you would like to add something to that from your experience.
Yeah, Dr. Imran has raised excellent points. In addition to that, a few do's and don'ts, a few general practices is what all patients need to understand. That this is a chronic disease. It can come and go. It varies with seasons. It varies with your moods. It varies. It can flare up if you get an infection. So all of these things, you identify your own triggers and learn how to avoid those triggers. So, for example, there are a few people who get a cold very frequently, and every time they get a cold, the psoriasis flares up. So
Mm.
they can take influenza vaccinations these days. Those are available. Common sense practices like washing your hands, wearing a mask when you're visiting somebody who's sick, etc. These things can prevent psoriasis flares. Secondly, the most important thing is not to simply rely on medications alone. We've talked about how it is intricately correlated with your lifestyle, with your weight, with how much exercise you do, how overweight you are or underweight you are you diabetic? So all these things, if they take care of these things, they exercise regularly, they improve their diet, they take a low carb, low calorie diet. If they're even slightly overweight over their ideal weight, they try to reduce it, do some kind of meditation. So the second aspect of it, apart from genetics, like we said, is the immune system. And the immune system is intricately linked with your mind, your brain. So it has been shown that people who have a tendency to be anxious or to be depressed, if they do simple meditation, etc., if it is bad enough, if they take the help of a psychiatrist, maybe need an antidepressant or learn to manage their condition with the help of a professional, that helps a lot in psoriasis. And other small things we need to tell them is not to pick their lesions, not to scratch them, not to rub them, not to try to remove the scales because it worsens psoriasis. And another thing which I tend to counsel, and which because their psoriasis is such a common disease, and these days patients tend to go online in search of miraculous or magical cures. And there is no dearth of these things being advertised online, all of which are false. So we proactively need to warn our patients and tell them about not falling into these traps, because time and again we see patients who are very well controlled. So, and this is you asked about maintenance of remission. That's why I'm saying this. This is extremely important. Patients are doing well, but they say, I'm taking this allopathic medication. I don't know what all problems this is going to cause. I must try to get a permanent cure, so-called jad se ilaj. And there are dime a dozen people, websites, all sorts of information which promise this. And we have to tell them that it simply isn't true. You have to take the medication. If the doctor decides that the time is right to get off the medication or to reduce it, like Dr. Imran was saying, you do that. But in an attempt to find a cure, time and again, we see patients who were doing fantastically well fall into the trap, get back into very severe disease, and the whole cycle has to be repeated, and overall their suffering goes off. So maintenance of remission is a multifactorial thing. Adherence, sticking to what your doctor has told you, avoiding the things that aggravate your psoriasis, and not falling into the temptation of trying to stop your medication or going for some other medication that is promising a fantastic cure, because we know that it is such a complex disease that science so far does not have a cure for these kinds of diseases. Why only psoriasis? All of the diseases that are associated with genetic component and have immune problems, none of those have a cure as of now, and maybe not even in the foreseeable future for the next 1 or 2 decades, maybe later on with advances in. So this conversation we need to have with our patients so that they don't fall into the trap of these false hopes, and stick to their treatment plan. And with that, every qualified dermatologist will be able to assure their psoriasis patients that we can keep them almost completely free of disease, almost all of our patients, if they are following the advice, and periodically, maybe 3 or 4 times a year, following up with their doctor for periodic checkups or just maintenance of what you need to do, whether you need to bring down your medication a bit or to stop it for some time and see, or to step it up a bit. So these it's something that has to be maintained in the long term. And then the patients can lead very, very nearly normal lives and with minimal or no psoriasis. So that is the message that needs to go to the general population.
Thank you, Dr. Abir. Coming to Dr. Swapna, so since we are discussing on the treatment approaches only, how common is misdiagnosis in the case of psoriasis, since we have other skin disorders also, and how much delayed are patients in seeking the right treatment when it comes to psoriasis? What are the worst cases that you've seen, if you could share your experience?
So he tries to tell him that it's just a dandruff. He uses multiple shampoos. He waits for a long time and he tries all the home remedies, and just like that, he pushes time. So that is the major area of concern. But other areas, most commonly now with the internet, now people are diagnosed. If they see a scaly patch, they probably coming thinking that is it a psoriasis. They want to listen. They already have prepared their mind and they just come to check with the doctor. Is it a psoriatic patch? That is how it's happening. But mainly the scalp is the most common place where an inverse type of psoriasis. That is one areas where people tend to think it is a fungal infection, like a ringworm. They tend to be treating with antifungal cream, some over-the-counter products. They just use, and then they feel that it is not responding, then they come down. So these are the most common areas where we find difficulties. Patients take a long time to turn up, and they have in a bad severity or a shape, they come down for the problems. So it is, though it is small or big, you better meet a doctor. Proper treatment, starting them at the right time, they help to get a relief of the symptoms even rapidly. They don't need to wait, suffer for so long, and then come back to the doctor for the treatment. Though it is a difficult answer for them to accept, but proper discussion with the doctor. Many people are frightened, like they see the images on the internet. Once we say psoriasis, though it is only scalp, they are worried about the whole body patches. So we have to discuss with the patient. Not always all the patients will develop whole body patches. Sometimes there are limited areas where, like scalp, or only in the hands, or only in the feet, the patient can have a limited type of psoriasis. And there are no investigations also available to predict whether will you go into that type of psoriasis or not. So there is no point of worrying or add stress to the problem, because we have already told stress is definitely an important trigger for psoriasis. So you are just adding to the problem and making it worse. So in these scenarios with the limited problem, we're definitely minimal topicals and using a proper anti-psoriatic medications or shampoo formulations like scalp and avoiding steroids for longer period in the underarm or in the flexural areas will help to prevent the complications and also get them out of the problem and have a healthy life like any other patients.
Thank you. Dr. Soma, if you would like to add something to that.
Yeah, I mean to say, yes, we come across a lot of times, commonly, as she said, that inverse psoriasis is mostly we treat or has been treated for candidiasis, for intertrigal candidiasis, fungal infections, and then we suddenly realize, okay, it's not responding to the regular drugs, so we have to investigate it. Nail psoriasis, again, is something which normally a lot of patients do not realize that it's the disease which is coming in, because they think that the nails are turning brittle, they are breaking probably because there is a deficiency of calcium, I'm not been eating well, so probably because of which I have this. Again, as I said, dandruff is a commonest. Again, people feel that it's a simple dandruff, it will go away, and they start using different shampoos, different formulations, try to visit other salons rather than the doctor to first take care of these things, which is commonly the practice. And finally, when they are tired and they see that there is no response, then probably they walk in to your clinic to get diagnosed it rightly. The other scare, as rightly said, is that they feel that this disease is contagious. Will I pass on this disease by touching somebody? Or will my spouse or my partner or my parents or my kid would get this while I touch this, because it is visibly seen. You know, it's there on the hands, it's there on your face, sometimes it's on the body. And this is something which bothers them a lot. The first thing is I've seen that the patients are a very difficult time accepting it. You know, that I have this condition and this is going to be a chronic condition with me for life. So this is somewhere, you know, you have to be very empathetic towards your patients. You have to explain them how the disease evolves, what is its waxing and waning periods, and how it can be tweaked with simple methods that Dr. Abir completely said, that you have to have lifestyle modifications very, very predominantly particular in your regime. The food you eat, the sleep cycle, the water intake, the physical activity, the exposure to the sunlight, all of these are equally important as much as your drugs are. But the most important thing for all the doctors and us as a practitioner is to put this disorder in a simple terms for them to also understand. I always feel when you explain the patient what they are going through or what they are having, it is much more easier for them to accept as well as follow the routines what we are talking to them, because it's otherwise it's a Greek and Latin to a patient. If I just tell them all the scientific words, if I use all the jargons to them, it doesn't make any sense to them. So, you know, I have to break them into simple words, relate them into day-to-day activities, and when you do that, they also understand it better and then they follow it up better. Like, for example, if you're a patient of blood pressure and diabetes, we tell them that this is the medication which you have to take it for life, right? And they do take it routinely. They know that if I don't take this, I will have consequences, right? So similarly, for my patients, I put psoriasis in that category and tell them that this is one of the disorders for skin. As you have blood pressure and diabetes, psoriasis is like a blood pressure and diabetes of skin, as you can say. But for this, again, you have to continue your medication. You have to come to the doctor on the timely visits to titrate the dosages, to see when if you're in remission, what you can do. If you're getting the relapses, monitor your relapses. Why is it happening? Change your environment, change your surroundings. See, there is a lot of stress for all of us and everybody goes through it. Stress is a common factor for all our disorders, but it's very nice to say to them, don't take stress, but that doesn't happen that way. You also have to imbibe the culture of stress mechanism, coping mechanism. So how they can do it? By indulging into certain amount of physical activities, certain amount of hobbies. So we have to also function in a way which gives them a complete treatment protocol for them, not only with the medical therapies and whatever treatments we have, or whatever medicines we are applying, but also if we can make a change to their lifestyle, to their diet. So it's a complete package by itself. And I think it starts basically from diagnosing it right. Sometimes if we cannot diagnose it rightly only by the physical examination, we do certain basic investigations. Sometimes we do go for biopsies, though psoriasis is a very, very characteristic lesions which are presenting. But sometimes, you know, it has overlap syndromes, it has overlap conditions, and there you have help of other tools with you where you can actually diagnose them correctly.
Okay. So just in addition to this question, Dr. Imran, how difficult is it to manage in children as compared to psoriasis in adults? How different does the treatment and management become? Because in children, of course, there are a lot of things that they don't understand, and the symptoms that they're having, they might be difficult to manage or control. So how does your practice change when it comes to adults and children?
Yeah, I think it's a very important question. And treatment in children is a bit different from treatment in adults. First and foremost, you have to remember that uh, childhood psoriasis means the patient has to now face a very long life with psoriasis. That is one, because this disease started very early in life. Second, so you don't tend to give such treatments which will have long-term consequences on the patient. Now, the choice of systemic treatment in pediatric psoriasis is not the same as in an adult. Very potent immunosuppressants, which you would prescribe in an adult, you tend to underprescribe in children. You don't want to give them potent immunosuppressants in a very early age, because if you start with potent immunosuppressant, it will be difficult to control the disease later with milder medications. Third, steroids, which topical steroids are the mainstay of treatment in psoriasis in adults. We use them in combination with certain other medications like vitamin D analogs. But topical steroids in children are very tricky to use because the absorption is more in children as compared with adults. Has to use them for a long time, so the incidence of adverse effects on the skin will be more if you start topical steroids early in life. So you have to keep in mind all those factors while you decide on a treatment option in a pediatric patient of psoriasis. So more hand holding of the patient is needed, and not only the patient, I mean the parents also. So you have to treat the child as well as the parents who come along with the child, because they're also psychological distressed as the patient is himself or herself. So choices of treatment in children are more limited than in adults, and the treatment strategy is a bit different than in adults.
Thank you so much. If anyone would like to add anything to that question.
Yes, we have to involve the whole family in pediatric psoriasis, and because it's a traumatic event for the parents as well. And parents are the caregivers, especially in very young children. The diagnostic problems are also more common in children because they usually go to pediatricians first, and many times psoriasis is not easily picked up because, especially in children, it can look more like other skin diseases compared to adults. So it is rather slightly more difficult to diagnose many times. And equally important as far as the treatment intricacies that Dr. Imran talked about, because we tend to be extra careful with children. We try to give them mildest possible treatments, and we have to counsel the parents about the do's and don'ts, about the importance of regular treatment, and also to explain the children how to control the itching, etc. Because if you scratch and rub the lesions, they tend to get worse. So those aspects need to be taken care of better. Plus, learning, etc., gets affected. So children can sometimes start to be bullied in school because of psoriasis. They may lose interest in studies. They may not want to go. They may get depressed, and these kind of things are not easy to pick up in children. And so all these peculiar difficulties that children may have in psoriasis also need attention and discussion with the parents. And we try to talk about this. And if we pick it up, then that has to be addressed as well.
Okay, well, that was my last question. I would request all the panelists to share their message for the audience, starting with you, Dr. Swapna.
Yeah. So, though the psoriasis, I feel, is a chronic problem, treating it properly can help them to get back to their normal quality of life, can be restored, and just live like every other people. Leave the panic. Please meet the dermatologist who can help you, guide you. Please come out of all the problems and have a healthy life.
Dr. Soma, your message?
Yeah, I would tell that kindly please address this disorder with a lot of serious note. Do not self-medicate. Do not go for any miraculous treatment. Nothing is available. Please visit the dermatologist, get the course rightly directed, and then stay healthy. And you can definitely lead a healthy, normal life, unlike other people. So, yes, this is something which you should be going through a proper channel for your treatment of psoriasis.
Dr. Abir, your message?
Yes. If you have any kind of a rash or a scaly rash, please visit your dermatologist. Don't postpone it. Don't do self-treatment. If your general physician is not able to diagnose it in the first instance, please seek the help of a dermatologist. Do not look for information on psoriasis on the internet without the help of your dermatologist. That will result in severe confusion, mostly 90% wrong information online. You will not be able to access the correct information because it is buried in those websites that are never on the top of the search engine first few pages also. So if you want to know, discuss it with your doctor. Ask for online resources about psoriasis. Your doctor will tell you which sites to go, which will answer all your questions on psoriasis. And please remember that even psoriasis, we keep talking about a chronic disease, it goes away for months, years together in many patients, and they are on no treatments at all. So let the message not go out that psoriasis is something like high blood pressure or diabetes, where you are constantly taking a tablet or doing something lifelong. It is a disease that in a very large number of patients completely goes away without leaving any trace for weeks, months, and sometimes years together. But it can come back. And those comebacks, to the extent that we have it in our control, there are several things that we now know that can reduce the likelihood of that happening and, make your remissions longer and make you live a nearly normal life. And every day we are getting newer and newer treatments for psoriasis in our hands, which are more safer and more effective than before. So never be afraid to consult a dermatologist about these kind of skin problems.
Great. Dr. Imran, your message.
Yeah, I would say, first of all, psoriasis is treatable. So remember that. And psoriasis should not impact your life. So you can treat your psoriasis in a way that you can live certainly a normal life. So don't let psoriasis impact your life. Treat it well, treat it with a proper dermatologist, follow his advice, and never, never, never self-medicate. That's the message.
Well, thank you so much, experts, for such an interesting panel discussion on psoriasis. I would like to take a moment to express a heartfelt gratitude to each and every one of you for taking the time to attend today's webinar on Beyond Skin Deep, the need to bridge the gap in psoriasis management. Your presence, attention, and engagement means a lot. Thank you all for joining us today. Wishing you all a wonderful day ahead. Thank you.
Thank you.
Thank you so much.
Thank you.